Gwen, thank you so much. Well, February is American Heart Month, and it's a good time to remind women that they are not immune from what's long been considered a man's disease. In fact, heart disease is the leading killer of American women, but most women aren't able to identify most common symptoms of a heart attack. Joining us this morning, Dr. Rachel Berger, who's a cardiologist with the Cardiovascular Group. Dr. Berger, good morning to you.
Good morning, Allison.
You know, for a while I was a health reporter. I've been here in this position for almost 11 years, and I've heard this over and over again, but still it's hard to really understand that 1 in 3 American women will come down with heart disease. Why is that in our minds so unlikely?
Well, for so many years, we've thought that it was a man's disease, and the typical picture is a middle-aged man clutching his chest with a heart attack. And we're learning over time that it is not just a man's disease. It's always affected both men and women. But we're starting to recognize the symptoms. It is the #1 cause of death and disability among women. It beats out breast cancer, lung disease, other cancers combined. And women tend to present later. So we're not seeing it until women are, 10 years older than men in terms of presenting.
Does heredity play a role in this?
Absolutely. Heredity is key. And when we talk about heredity, we're talking about, strong family histories of first-degree relatives, mothers, fathers, brothers, sisters, with early heart disease. And in fact, when they look at men and women with cardiovascular disease, they see that heredity actually plays a stronger role in women than it does in men.
Let's talk about the classic heart attack. Men and women, we have different symptoms. We present these symptoms differently. What are the big differences?
Well, the big difference is that men tend to, and not all men, but men tend to present with chest pain or chest discomfort, whereas studies have shown that only about half of women will present with chest pain. They're more likely to present with alternative symptoms, things like unusual fatigue, just not feeling right, feeling short of breath, feeling nauseous. And because these symptoms are different and can mimic other things going on, they're less likely to recognize this as heart disease and less likely to seek medical attention.
2 other symptoms that we just showed the viewer at home, indigestion also, and anxiety. Well, anxiety can mean anything that we feel. I mean, we're women, right?
Absolutely.
Okay, so this is half of the problem, is it just can be confusing, these symptoms.
Symptoms can be confusing, and they also tend to present in different times for women.
Okay, and I'm sorry.
So men typically will present in an exertional sense, although they can present at rest. Women can present in settings of mental stress, rest, sleep, so they may be presenting at different times as well.
And we're showing the major symptoms during the heart attack, and as you said, shortness of breath, weakness, unusual fatigue, cold sweat, and also dizziness. Now, when this happens, are we able to, in these symptoms, call for help? Or does somebody else know to call for help for this? Or is that part of the problem as well?
Part of the problem is recognizing your symptoms. Women so often are caretakers of other people. They're caretakers of their husbands, their parents, their friends, their children, and they fail to recognize symptoms in themselves. So when you start to feel these symptoms, it's important to seek medical attention immediately. Okay. If you think you're having a heart attack, call 911. Get emergency medical services involved. I mean, they are trained to start diagnosing and therapy from the moment they pick you up. They're not just a transporter. And that's key in heart disease, because every minute that you waste could be affecting your heart muscle.
We want to leave the viewers with some uplifting news or some things you can do to try to stave this off. And can you pass along some lifestyle changes we could put into place now?
Absolutely. There are so many things that you can do to decrease your risk of heart disease. So seeing your doctor regularly, being screened for things like cholesterol, diabetes, hypertension are key. In addition, lifestyle changes, exercising regularly, at least 4 or 5 times a week, getting 30 minutes of moderate intensity exercise is key for heart health. Eating a heart-healthy diet, watching the saturated fats, the red meats, eating a lot of fruits, vegetables, whole grains. Those are the things that you can do to minimize your risk.
For you and your family, because you're right, so many people count on women and men, but in this case, women, and if we don't know the symptoms, it could be deadly.
Absolutely.
Dr. Rachel Berger is a cardiologist with the Cardiovascular Group. We appreciate it.
Thank you. My pleasure.
Steve, over to you.
All right, coming up on 8:38.